Hello and welcome to 5 Minutes. Today we're going to be talking about a controversial new cancer treatment for the metastatic melanoma. Pembrolizumab was registered by the TGA on the 16th of April 2015 for the treatment of unresectable or metastatic melanoma in adults. Pembrolizumab is a form of immunotherapy called checkpoint blockade, a treatment that uses your body's immune system to fight the cancer by interfering with the inhibitory signals that regulate lymphocytes. It is considered a controversial treatment method as turning off critical inhibitory signals can lead to an out-of-control immune response and potentially fatal consequences. Today, we explore immunotherapy, its journey of gaining TGA approval, and Maja's decision-making process.
I was diagnosed in the late stages, so it already spread to other parts in my body, making it a little bit more difficult to remove with just surgery.
This is Dr. Winslade. She's been following Maja's progress since day one.
Your radiotherapy treatments looked promising in the first few weeks, however, unfortunately they just have not progressed since. Now, in your last appointment, you talked about being open to the idea of immunotherapy, so I was thinking maybe you could try a new drug, pembrolizumab.
What kind of drug is pembrolizumab, and how does it work?
Immunotherapy checkpoint inhibition by pembrolizumab works by enhancing the body's immune system capabilities in order to kill cancer cells. T cells are activated when the receptors recognize and bind to a foreign cancer cell. Once activated, the T cells secrete cytokines, creating a pro-inflammatory environment that is toxic to the cancer cell. Cancer cells can evade the immune system by manipulation of the programmed death receptor on the T cell. This checkpoint regulation is designed to signal T cell apoptosis when immune activation is no longer needed. This allows the cancer cell to continue growing. Immunotherapy, such as pembrolizumab and nivolumab, bind to the PD-1 receptor on the T cells, blocking apoptosis. The T cell survives, continuing to fuel a toxic environment, destroying the cancer cells. Another form of checkpoint inhibition, immunotherapy, involves the CTLA receptor. When B7 is bound to CTLA4, it acts as a stop signal. During normal immune function, this checkpoint is designed to stop an overproduction of inflammatory signals, which prevents the destruction of the normal surrounding tissue. Ipilimumab inhibits this process by binding to the CTLA4 receptor. Therefore, B7 can only bind to CD28 and induces a continuous pro-inflammatory state. This increases the destruction of cancer cells. However, it also causes destruction of surrounding tissues that are exposed to this state. Hence, ipilimumab results in some side effects.
However, in my professional opinion, I feel that pembrolizumab is the best treatment option for you.
Okay, thank you, doctor. I'll consider.
I was fairly convinced by the possibilities of immunotherapy. However, as it's still a pretty new option, I wanted to do my own research into the downsides and side effects. What I'm more worried about are the more serious side effects, because it involves tinkering with your immune system. I've read about thyroid abnormalities and changes to liver enzymes, and even anemia and lung infections. I'd just like to be reassured that pembrolizumab is safe enough to use.
At the TGA, we look for cancer therapy drugs to be efficacious and safe. One of the markers of efficacy we use is the response evaluation criteria in solid tumours. This scale objectively determines the impact of the treatment on tumour size. Studies on pembrolizumab shows that 11% of patients had complete responses, that is, the tumour completely disappears, 45% a partial response, a reduction in tumour size by 30% or more, 27 had stable tumour sizes, and 17 had a progressive disease with an increase in tumour size by 20% or more. Nivolumab and ipilimumab also show efficacy with a complete response of 12% and 11% respectively. These statistics show that immunotherapy has a significant improvement against the standard chemotherapy alkalizing agent dacarbazine on advanced melanoma tumours. The TGA also looks at toxicity of immunotherapy. Adverse events were reported in 10% of patients for pembrolizumab, 19 for ipilimumab, and 22 for nivolumab. The most common immune-related side effect was diarrhea, hypothyroidism, and hepatitis, with treatment ceased if these would occur at grade 4 severity. Hepatic monitoring is required for pembrolizumab and ipilimumab, while nivolumab patients may develop difficulty breathing. Immunotherapy drugs are safe and efficacious for advanced melanoma.
We've been in touch with Maja and treatment has been progressing well. Checkpoint immunotherapy holds great potential in becoming one of the key strategies in fighting cancer, along with chemo, surgery and radiation, and might even be used in the treatment of other cancers in the